Days after a Houston hospital announced it's halting gender-affirming care for transgender kids, Fox 4 has learned that a similar program in Dallas had already stopped taking new patients. The program still treats current patients, but it's for months had been referring new patients to other providers. Stephen Dial, live in downtown Dallas with our story. Stephen.
Steve, the change to what was called the Genesis program ended months before Governor Abbott directed agencies to investigate parents who got their children gender-affirming care. Texas Children's Hospital in Houston announced last Friday that it paused its hormone treatment for transgender children. The hospital said it was a direct response to Attorney General Ken Paxton's legal opinion that those treatments should be labeled child abuse. Governor Abbott recently took the opinion a step further, calling on people to report any child who appears to be getting gender-affirming care and directing the Texas Department of Family and Protective Services to open investigations. The hospital said it wanted to, quote, protect families and employees from potential criminal charges. Dr. Marcial Oquendo is a pediatrician in Dallas and a member of the Dallas County Medical Society.
There is a lot of hesitation in the medical community, even of those who provide these services on a regular basis, and those who do not. But everyone is they don't know how to react.
When Fox 4 started looking into whether Children's Medical Center in Dallas offered similar hormone treatments, we learned a partnership with UT Southwestern called Genesis, a clinic designed to provide gender-affirming care to adolescents, had been scaling back for months. Branding for the clinic disappeared, and in November it stopped taking in new patients. Existing patients are still getting hormone therapy. In a joint statement released to Fox 4, Children's and UT Southwestern said, "We have not experienced interruption of pre-existing care or services for our pediatric patients who were already receiving care with these specialty teams. New patients seeking hormone therapy and puberty blockers are accepted for evaluation and referred out for services we do not provide." Dr. Oquendo says because the governor's directive isn't law, hospitals still don't know what constitutes as child abuse.
Until it's clear which ones those are and what constitute failing to report, what constitute the actual abuse. Is it only medications? Is it only the surgeries? Is it everything? Is it even counseling? There's a lot of questions that still need more clear answer. And a lot of people are trying to figure those out.
Harris County's district attorney has already promised that her office will not prosecute such cases. Dallas County District Attorney John Creuzot also said he would not prosecute families. Tonight, I talked to one of the mothers of one of the first children to be in this Genesis program. He's now an adult. She says that he is grateful for being in that program.